More now from Dr. Alicia Shelly. She is an expert on treating obesity. And boy, are we glad to have you here today, because I think this has piqued a lot of interest, not just in the United States, but beyond, where these pills are going to be approved now. How much of a game changer is this, do you think?
Oh, this is a huge game changer because this is going to be able to allow people the option to have a pill instead of an injection. There are many people out there that don't particularly care for shots, and so this is another alternative.
As I understand it, the doses are lower. Will this change the effectiveness of these drugs, and could it possibly lead to fewer side effects?
Yes. So actually, in studies, the average weight loss was around 13.6% with the oral Wegovy pill, whereas the Wegovy shot was around 15% or 14.9%. So it's very comparable when we look at what's the average weight loss that you can see. And we believe that at least you still have the same side effects of nausea, vomiting, diarrhea, constipation, but it's a little bit less with the pill than with the injection.
And to be clear, you have to take these pills as well for a very long time to see that transformation in your weight.
Yes. So in the studies went for about 68 weeks or almost a little over a year to see that same percentage as well. That's correct. Mhm.
So I have a question for you on if you believe this will expand access to this. But the nuance to the question is, as a physician, do you believe it should expand access to this? Is this drug, these drugs, these kinds of drugs so transformative that it really will change people's, lifespans and their lifestyle?
You know, when we look at the GLP-1s and how it affects not just only weight loss, studies have shown that it affects as far as your cardiovascular risk. It helps with reduction of mortality from cardiovascular disease. If you've had a history of a heart attack, stroke, or peripheral arterial disease, it's been shown to improve fatty liver disease or MASH, as well as sleep apnea. So, and of course, type 2 diabetes, which is what it was initially approved for. And so with that being said, I've seen in my practice, people who not only are they getting their life back, where their medical conditions are improving, but then on top of that, they have more energy to exercise, energy to do other things, and to improve their not only their life expectancy, but just their overall health being. And in the study with the Wegovy pill, they looked at physical function, and they noticed that people actually improved their physical function when they were taking that Wegovy pill. So these medications are very transformative for our patients. And I think this is just the tipping point. We're going to see a lot more medications come out that can also help people live a more longer, fuller life. Mhm.
So interesting. And actually, I want to ask you, you did describe, some fairly severe side effects for some people. What can you do to mitigate that? I know that sometimes the loss of appetite, the nausea, those kinds of things really affect people in different ways, but sometimes those side effects can be severe. I mean, should you be doing more exercise? Should you really be paying close attention to what you're eating? What else do you have to do here, since we may get a whole new group of people taking these drugs?
Yes. So it is important that you combine lifestyle intervention with the medication. So it's important that you watch what you're eating, making sure that you're eating a balanced diet, and also make sure that you're eating your protein. What we find, because people are not that hungry with it, sometimes you forget to eat. And so by making
Wow.
sure that you're getting your protein in, getting your calories in, it actually can help with reduction of that nausea. I've seen some people, because they weren't getting enough protein, tended to be more nauseous. So when they improved that, it improved on its own. The other thing, it's important to actually start at a lower dose and taper up slowly. So sometimes if we tapered up too fast for a patient, they had more symptoms. But when we went back down on the dose, they did better. So it's important to make sure that you're working with your physician, that they're monitoring you during this process and actually making sure you're on the right dose for you.
Yeah, and actually you make such a good point that this should be done with the guidance of a physician. I want to ask you though, Dr. Shelley, do you envision people being on these drugs for a lifetime?
I can. And the reason being is that when we look at obesity, obesity is a chronic disease. And so there's so many different factors. Those factors can be genetic, it can be medical conditions like PCOS, hypothyroidism. And so these factors are things we cannot change. And so sometimes people may need medications to help manage their weight as well. So for some people, they may not necessarily need to be on it forever, but for others, they may need to. And so it's important that we give people room. Sometimes people feel a stigma against being on a medication to help them to lose weight. A lot of my patients come in my office and are like, well, how long do I have to be on this? And my
Right.
response is, as long as your body needs it. So it
Huh.
just depends on the person.
Yeah, you treat it like a chronic disease, like as if you have cardiovascular issues. It might be some other drug that you're taking, and that you wouldn't object to taking that your entire life. Dr. Alicia Shelly, Happy New Year to you. A lot of good information in there. I really appreciate it.
Thank you. Happy New Year.